Hey there guys, Dr. Davidson again. So we're talking about chronic pain kind of drills, right? Because a lot of the time, we're sure we have some instances where we may hurt our back, whether we're lifting something, a quick motion or something like that. But how do we start to change our movement patterns to ultimately reduce the likelihood of this ever happening again, right? What we're going to talk about today is the hip hinge, right? How do we properly move our back? And we all know that we should bend and pick things up with our legs, but it kind of gets, that's as far as we kind of get with that kind of stuff. So today we're going to be talking about that hip hinge. We're going to talk about how we can use something like a PVC pipe or a dowel or a broom handle to kind of help us kind of cue into how we should be moving. And also ways that if you don't have one of these, what we can do, okay? So first, we're going to talk about how to not use something, okay? Right? When we're thinking about where we want to hinge, right? Of course, it's called a hip hinge, so we're going to hinge at our hip, right? But we can kind of get lost in where exactly is my hip, right? I can feel the bone out here, that greater trochanter. Is that my hip? I can feel my hip bone up here, my iliac crest. Is that my hip, right? We have the ischial tuberosity, our sit bone. Is that our hip, right? All are correct, right? I actually like to think of a little triangle, right? From that trochanter out on the side, that hip bone up on the top, and that sit bone back here. If I think of a nice little triangle, dead center is actually where we're gonna have that articulation, that ball and socket. So what I'm gonna think about is that spot. I wanna imagine pivoting around that, right? And some good cues that we can use for that is thinking about taking that bottom part, that ischial tuberosity, that sit bone, and pushing it back and out, almost like, let's imagine there was a door open behind us and your hands were full, right? We're gonna bump that back, right? I'm not gonna bump it back by rounding my back, right? I'm just gonna poke my butt out, right? So that's a good cue that we can imagine in our triangle, poking that butt back out. And honestly, when we're working on the hip hinge, that's all we need to go. I don't need to go, oh my God, all the way into front forward flexion. That's a great stretch for those hamstrings. That's a Romanian deadlift, or that's a good morning. So those are great exercises to do anyways. But when we're talking about chronic pain, acute care, just trying to get out of that pain scenario, how do we start to move? Keeping that spine nice and straight and just getting used to hinging at that singular point is going to be a great starting off place. Okay, let's say you do have some tools though, all right? PVC pipe, dowel, whatever you have, broom, totally awesome, right? So ways to kind of reinforce these movement patterns, right? There's two things that we can do. One focuses on spinal stiffness and straightness, right? Which again, I'm okay with having rounded spines eventually when we're lifting and whatnot. But in this case, right, when we're trying to hammer in really good motor patterns, let's work off a straight spine. The other is going to be working on exactly where we're hinging the hips. So starting there with the hinge, okay? What I'm going to do is I'm going to take the dowel. So we have the bony guys in the front of the hips, right? Those ASISs, right? What I want to do is I want to fall just underneath that, right? And you know the pubic bone right in the front, right there? In between the two of those, right? If I split the difference, that's exactly where I'm going to put my PVC pipe, my dowel, my whatever, right? Same idea though. We're doing that hip hinge. And what I want to do is I can imagine fulcruming right over it, right? And from here, you can almost see that the pipe doesn't really move. It moves backwards, but it doesn't roll up, it doesn't roll down. We're just hinging straight back, right? I'm keeping that core nice and tight, right? If you haven't figured out or haven't really worked on that core stability, let's hammer that in, right? Because that's super important. Check out our videos on that. But working off that hinge, right? Again, I'm not going super far. I'm working off of that. The other bit that we can use this pipe for is keeping that spine straight. So what I'm going to do is I'm going to throw the pipe behind my back, right? So in the small of your back, right, the normal lumbar lordosis back here, right, you should be able to fit that hand in. I shouldn't be flat back here. I should have 3 points of contact. My tailbone, my sacrum, my mid-back, my thoracic spine, that thoracolumbar junction, and then my head, right? So there should be 2 gaps, one at my neck, one at my low back. And from here, right, I want to keep all of those points of contact and all those spaces, right? I don't want to round out. You see how I lose contact here, I gain contact here. We don't want any of that. I also don't want to bend and round through the top. I can grab up here. It doesn't necessarily matter, whatever floats your boat in that sense. But from here, I'm working on, okay, can I keep that spine straight? I get a great hamstring stretch in here. Again, fantastic. But when we're working off of how exactly we want to be moving our body in kind of this keeping away from certain motions that are hurting us, right? Rounding through the back, especially with individuals that don't know how to lift. That's gonna be a great place to start off. So go ahead and play around with that, right? Realistically, the hip hinge is one of the most pivotal movements of all, so practice it throughout your day, right? Even if it's just thinking, oh, let me push my butt back as I'm sitting down to get onto the toilet, as I'm sitting down into bed, right? Places that we normally just kind of flop ourselves into. Let's think of putting that butt back and down, okay? So play around with that, right? And let us know how it's going, okay? Yeah.